Hello. Good day. Uh, Welcome to Dr. AZCC Health Tips Corner. Thank you for joining us today. Today we'll be discussing fibroadenoma or benign breast lump. This is a very common finding among females of childbearing age. Any lady who is seeing her period or menstruation between the ages of 15 to 35 and beyond. At least this is the range where it is very common. Okay, because it is very common, it is also important that we have an idea of what it's all about. Fibroadenoma, they are usually solid lumps found in the breast. The breast lump is not a breast cancer. It is important to know, okay, that fibroadenoma is not a breast cancer. They are usually benign lumps, and because they are benign lumps, it is also important that we take note of them very early so that we don't miss out breast cancers when they occur. Okay, it can be found in any age group apart from this range that we mentioned. This is the age range, is a range where it is very common, 15 to 35. Okay, it is also the commonest breast lump amidst other types of breast lumps. Breast fibroadenoma or benign breast lumps, they usually do not cause any form of pain. Okay, however, on their own, they are usually round and they are smooth surfaced with firm or rubbery consistency. When you touch on them, they are usually rubbery or firm. Okay, and one very common thing about them is that they easily move around, and when they are very small, it becomes difficult to palpate or to feel, and because of that, they are known as breast mouse. You know, the mouse in the house, usually they run around, difficult to catch and to kill. So fibroadenomas, because of their peculiar sizes when they are small, maybe like a small peanut or a small maize grain. Okay, and on the average, they are about 2.5 centimeters on the average, about 1 inch in size. So that size in the midst of a larger breast tissue may be difficult to palpate. You can understand why it's called breast mouse. Okay, however, it can get bigger over time, and in as much as most of these breast lumps are not painful, fibroadenomas are not painful, they can become painful few days to menstruation. Okay, and a larger one, bigger than the usual sizes, when you touch them, may be painful on its own or may be hurting. So most of these types of most of the breast lumps, as I said, fibroadenoma, do not cause pain. Okay, they may be single, usually single, or more than one, and it may affect either breasts or both breasts. So fibroadenoma can affect any of the breasts and any positions. Okay, some of these lumps over time may shrink in size or reduce in size. This is not very common. However, in the adolescent age, as they get older, the lumps may reduce over months to years. Okay, they may even disappear. That is why it's important to continue to examine the breast to monitor the progress, the change in size of these lumps. Okay, because of the relationship to menstruation, one is beginning to think it has to do with the hormones related to menstruation and pregnancy. Because in pregnancy, it has been found that fibroadenoma become bigger. Okay, they become bigger, and in menopausal women who are no longer seeing their period, the lumps also tend to shrink. There are other forms of breast lumps or complications of fibroadenoma. They may be giant when they become bigger than the usual size. They may have complex shapes and sizes. and the other forms the phylloides tumor. Okay, so it is said that some of these things may be related to the hormones. Okay, how do you manage fibroadenoma? Fibroadenoma is not cancer. I must maintain that it's not cancer, but you need to identify early enough that you have a breast lump. Okay, when you identify, how do we identify this? By breast self-examination. In one of our earlier episode, we had presented breast self-examination. So do well to go back to our previous posts and you find the breast self-examination to see how you can do that. Okay, and also it can be done by a health professional who will professionally examine the breast, looking out for those lumps. Okay, the armpits may also be examined during these examinations. The earlier it is identified, the better. One can monitor progress if one is not willing to remove it immediately. Okay, however, it is advised to know what type of lump it is. For that reason, a surgery is important in this management, and that surgery is removal of the lump, known as excision biopsy. Biopsy because when you remove the lump, it will be sent to the pathologist who will examine the lump and then know what kind of breast lump it is to confirm whether it is fibroadenoma or something else. Okay, when that is done, then be rest assured, if fibroadenoma, you are not worried. It can recur, it can form in another part of the breast, but the important thing is that you continue to examine the breast and then send the sample to the histopathologist after the lump has been removed. Thank you so much for joining us one more time today. We expect that you continue to join us in our inciting topics that will help us in knowing more about our health and finding solutions to them. Thank you and do have a nice day. Bye. Thank you.